in Al-Aqsa Hospital where I just left the resuscitation room where a 9-year-old boy named Ahmed was being treated basically with sedation to ease his suffering as he dies. He was crossing the street in front of the shelter where his family is staying when the building beside him blew up. He was hit by shrapnel, by rubble. His brain matter was exposed. He was taken to a hospital close to where he lived in Nusrat, and they transferred him here to Al-Aqsa. But there's nothing anybody can do for him. Like so many cases here, there isn't capacity to manage complex neurological cases, complex trauma cases. The operating theaters are working 24 hours a day. The emergency room is far, far beyond its basic capacity. You're seeing kids like Ahmed dying unnecessarily because of bombing and fighting, and because the health system doesn't have the capacity to even come close to managing these kinds of complex cases among the hundreds and the thousands of cases that come through these doors in front of me every day.
Children are dying unnecessarily. That's the message that Sean Casey, an emergency medical team coordinator with the World Health Organization, had to give. Let me bring in my next guest, Dr. Omar Abdel-Mannan. He's a British-Egyptian pediatric neurologist who has worked and taught in Gaza over the past 10 years, and he joins us live now from London. It's a pleasure to have you on the program, sir. You've worked in Gaza before, and you have a lot of friends and colleagues, I'm assuming, there. How often are you able to get into contact with them, and what have they been telling you about the situation in the hospitals there?
Well, thank you so much for having me on the program. The communications has been very, very patchy over the last 72 hours, if not longer. We are often struggling to directly communicate with our colleagues, our friends there. The one bit of hope is that some of our team members from the Oxford team that had been going into Gaza to teach and train medical students are actually hopefully now inside. They have joined a medical aid to Palestinians sponsored team that is currently undertaking surgery and needs assessment on the ground. So we are hoping that will provide us another source of information on a daily basis, speaking to our friends and seeing these first-hand eyewitness accounts, a bit like Sean Casey's account from the WHO, because I think the reality is we need to, and the world needs to see the genocide that is happening inside Gaza. They need to see that children are being massacred, that children like Ahmed, whose brain matter was exposed from rubble and shrapnel, this cannot continue. There are tens of thousands of children that are injured, that are suffering, and there are thousands that have died, and many thousands more will die if there is not a permanent ceasefire and if there is not a clear path to rehabilitating and essentially rebuilding Gaza. Because as your previous reporter said, there are only 9 functioning hospitals in the whole of Gaza, and they are all in the south. You have to remember that Gaza City was in the north, one of the largest metropolis for people in Gaza, and that is currently not, there is no medical aid going to these patients. So imagine a whole area of London, a whole area of Manhattan in New York, a whole area in Paris that is just completely derelict of basic medical care. Forget about we know there's bombing going on and there are atrocities, but there are patients that are dying from heart attacks, from dehydration, from diarrhea. There are people dying in droves because they are falling down, literally dying on the floor with no aid, no ambulances, nothing coming to them. And this is clearly an orchestrated plan by the Israeli occupation forces and by the Israeli government to decimate the whole population and wipe them out. It is clear. It has become so clear. They either want them to leave or to die. They have no alternative choice for them.
Right, and we're watching in real time those videos, for the most part, on our social media feeds of children that have sustained wounds. They're unable to cry from the dehydration and from the excruciating pain that they're experiencing. Thousands of children are dealing with these wounds that will change their lives forever, and the treatment that they've received so far just goes as far in stabilizing their health, but many of them, they do need reconstructive surgery that can take months, if not years, to heal. As a pediatric neurologist, I want to get your expertise on what would happen to these children and adults, for that matter, in the long run if they're not cared for medically.
So there's multiple issues at hand here. The first is many of the injuries that have been suffered on from blasts or from shrapnel, from injuries, could be salvageable and can be repaired if they are done within a time window. And this includes head trauma, this includes brain damage, where if you have a neurosurgical intervention at a critical time within the window, you have a chance of salvaging that child or that person's long-term cognitive outcomes, and you have a chance of providing them with some sort of semblance of a normal life. Obviously, it depends on the extent of the injuries, but when you leave children with horrific wounds that are not being treated because of the lack of aid coming in and because of the lack of personnel that are available to provide that expert neurosurgical or neurological intervention, then you are essentially sentencing them to either a life of disability, a life of misery, and a life of reduced cognitive and life outcomes. So these children are very likely, unfortunately, to be disabled. They are very likely to end up being stigmatized within their society. And I have seen cases. We saw a case sent to us not long ago from a colleague of a child who suffered injuries that essentially, if he had external fixators, a simple orthopedic implant that should be available, but obviously isn't because no aid is coming in, then that child could be salvaged. And instead, that child is now tetraplegic, which means they are paralyzed from the neck down. No movement in their arms, no movement in their legs, because of a simple piece of equipment that should have been there to allow them to be fixed. But that is what happens when you blockade a strip of land with 2.3 million people for 16 years, and you decimate the healthcare system, and you bomb the hospitals, and you bomb their bakeries, and you bomb their children. That is the outcome.
Doctor, on that note, I don't have much time left, but if you could give a very short message to the international community, to those who have the power to make real change happen, what would it be?
My message is, you've seen the pictures on your screens. The international leaders, you have seen these children being bombed. You have seen these hospitals being bombed. Enough is enough. If you're not going to speak up now, then honestly speaking, this is the role of the international community of citizens to stand up and basically say, this is outrageous, and people should be considering, and citizens should be considering, boycott, sanctions, and divestment of the money that is going to a genocidal psychopathic state that is terrorizing a population of 2.3 million human beings.
Dr. Omar Abdel-Mannan, thank you so much for being with us here on the NewsHour. I appreciate it.